This is a Santa Fe College special report discussing how informatics will affect the transition from ICD9 to ICD10. This report is brought to you today by Jenna Mueller and Jerry Newman. Since the time of the first computer in the 60s, technological advances have moved along like a speeding train, advances that have affected all walks of life. Finance, communication, and healthcare have experienced large changes due to the advances of the past 50 years. With technology comes a dramatic increase in information that needs to be stored, processed, and managed. Informatics is the science of that very need. In healthcare, informatics professionals are readying themselves for one of the largest explosions of information ever, the transition from ICD9 to ICD10. To understand this transition better, let's explore a little history. ICD stands for the International Classification of Diseases. These are the codes used to describe what diseases or injuries you have and what procedures you have done. This coding system is utilized by a broad spectrum of job titles for a wide range of reasons. The version currently used is ICD9, an ancient system in the terms of healthcare. It was first released in 1948 and gained international recognition by 1977. So much has changed in healthcare since that time. Laced with outdated terms and not in line with current healthcare services, ICD-9 is unable to expand sufficiently to keep up with the advances we have experienced in healthcare technology. ICD-10 offers more detailed codes with more specific information contained in the code and is capable of handling over 124,000 more codes than its predecessor. Out of 196 recognized countries in the world, 110 are currently using ICD-10. The U.S. is the last major industrialized nation to transition to ICD-10. This transition will bring the U.S. in line with a system that is used internationally, allowing information flow, research, and cost reductions in care to move forward. In 2009, the Centers for Medicare and Medicaid Services, CMS, issued a final rule backed by HIPAA that required the shift to ICD-10. With such a complex shift affecting so many across healthcare, we must have a lot of time to get ready, right? Not true. The implementation date is October 1st, 2014. That's only 16 months from now. The clock is ticking and many are already working diligently towards ICD-10 implementation. The anticipated benefits of the shift to ICD-10 are many. The increased level and quality of information collected and processed will affect how healthcare resources are used, how a healthcare facility performs, and how quality performance is measured. Public health risks will be able to be tracked more precisely, and ICD-10 will improve information collection and sharing, and quality care data will be more effective globally. The benefits of transitioning to ICD-10 will have short and long-term benefits. No matter where you work in healthcare, the transition to ICD-10 will change everything as we know it. Informatics is the science of processing, storing, and retrieving data. So exactly what role does informatics play in the transition to ICD-10? One of the first items deals directly with the data. Databases are collections of specific information that is collected from multiple sources. For a database to be useful, a database management system allows users to ask questions and retrieve specific information. A database management system facilitates efficient storage and retrieval of information, allowing multiple users to use and/or manipulate data without changing the original data. Data mining, the analysis of data from different perspectives, is expected to greatly impact the quality of care, cost containment, and revenue cycles and flows within healthcare, with the level of detailed information gained from the transition. Databases need people to manage and modify them to accept and properly use ICD-10. As we transition from ICD-9 to ICD-10, a number of healthcare functions will need a map to better track where a code was and what it might be now. General equivalence maps are a translation tool for exactly that purpose. While crosswalks do not provide a substitute for learning ICD-10, they will help to facilitate disease and cost reporting, assist in reimbursement, improve quality measures, and aid ongoing research and analysis. GEMS will make an impact in areas of healthcare where traditional studies of coding systems are not normally taught. GEMS can be used both from ICD-9 to ICD-10 and from ICD-10 to ICD-9. Software programs are available to assist in this translation. As illustrated here, the ICD9 code for an open fracture of the T7 to T12 region has multiple codes in ICD10 that are more specific to say what the actual fracture may be, whereas ICD9 is very general. This is the type of detailed information that will be available for use starting in October 2014. Training is considered one of the most critical factors to successfully implementing the new coding system. Extensive changes to systems, increased requirements of collected data, and increased volumes of information require extensive training to get ready. Training programs must be implemented to help clinicians, coders, administrative staff, and many more to understand the new level of detail required and to master aspects of anatomy and physiology, pharmacology, and medical terminology that have not been effectively used with ICD-9. Virtual or immersive learning environments are the cream of the crop in extensive interactive education. VLEs allow students to progress at their own pace, on their own schedule, communicate and interact with other students, faculty, and educators through discussions, forums, blogs, and virtual meetings. Students can track their progress much faster than traditional classes, and VLEs provide an environment where students learn from their mistakes before they start to use their skills in real time. Interactive software is in use that focuses on the increased levels of learning needed for the transition. Games like Second Life provide access to detailed information in simulation environments to master skills. Medical software provides easy-to-understand modules that help reinforce and expand healthcare knowledge. More and more healthcare facilities and educational institutions are using VLEs to keep their healthcare professionals on the cutting edge. Informatics keeps evolving and expanding to meet the increased needs and demands of our society. In healthcare, it seems like new tools are coming out almost daily. What does the future of informatics in healthcare hold? The transition to ICD-10 will provide significantly more detailed information about illnesses and their treatments. Smartphones, tablets, mobile devices, and the data collected from shared information between these devices and the healthcare facilities will benefit as applications become fully integrated with EHRs. Advances in technology and software integration will automate precise data collection, which in turn will produce better healthcare outcomes and safer healthcare research. Training will continue to advance to meet the needs of the patient through tabletop data interfaces and 3D virtual reality simulators with tactile interfaces. The transition to ICD-10 will continue to affect current healthcare providers and to help raise the standard on future healthcare education. The future of healthcare informatics in the wake of ICD-10 will also include exchange of information in the blink of an eye through regional and national health exchanges to connect our healthcare providers and provide more accurate care unlike ever known before. As we transition to ICD-10 and explore all of the avenues and expected improvements throughout every aspect of healthcare, these examples are only the beginning. Many informatics professionals know that all the advances are only paving the path to the next major healthcare transition, ICD-11. While informatics is not a new science, technology keeps advancing. There is more for informatics professionals to manage and discover every day. Are you ready to help make a difference? This has been a Santa Fe College Special Report. Thanks for tuning in.